they have to push with this. When we're pushing them down, we're pushing them with this, which is the hardest part of their body. If they're like this, so every time you push, they're going.
No, my son was
Nothing's
like that.
happening.
He came out, he was he looked like a pizza. He was
Yes.
so ugly. Completely black and blue.
Oh.
Because every time he was hitting my coccyx,
Yeah, your bones.
the
Yeah.
biggest pain ever.
Yes.
But anyway, he was black and blue for
Yeah.
weeks.
Very. Yeah.
He looked
Very-
like that pizza.
Yeah. Pizza.
So the only procedure if the face is up is for the doctor to do it manually,
Yes.
turn the face.
Most of the time we can't handle it. It's very. Yeah.
Oh, they did it with me, and I was afraid he was gonna break my neck.
Yeah.
That was my fear. Like,
Yeah.
what if when he twists it, something goes wrong and
Yeah. No. They're so soft. Yes, they usually they usually try to look through an ultrasound to see where the cord is, or they can feel it. At that stage of the game, they're actually putting their hands in there, so they actually can turn and they can feel if there's anything around them. But if they can't, a lot of times they use the ultrasound machine so they can see, guide them a little bit to make sure nothing is on the way. All right, so there's a lot of young women here who will never have a child now. And, now, let's say that the baby is coming out. The baby's large, okay? There's no room. We need more room. So we do an episiotomy. An episiotomy is the opening between your vagina and your rectum.
Oh, yeah.
The kid's already there. The head's there already. We need more room. That's it. So if we see, like, if we let it go, the kid can rupture your vagina, and your vagina is going to look like a flower afterwards. It's not going to heal properly. It's going to heal disaligned, and you're going to need surgery. They don't want to hear about it. She'll never have kids now. So the episiotomy, if we need the room, we see the baby's too large, coming too fast or too large, then what we do is that little opening in between there, we cut, it's like this much, we go, one cyst, and that opens up like 2 inches right there. Even though it's a tiny piece, it gives us extra room all around and the baby can come out. And afterwards, we sew it very nicely because it's nice and straight. So now we can sew it perfectly and your vagina will look nice and act nice. Because sometimes it becomes healed disaligned and it doesn't look right and it's very painful and uncomfortable afterwards, forever.
Is that a PE-based anatomy?
Episiotomy, yeah, episiotomy. Mm-hmm.
Because all of that, you cannot have your partner in the room when you're having a baby because it's very traumatic for a man to see a delivery. Tell me, I have heard guys, they cannot handle it, and from that, they stop touching their partner because they
Oh,
just
good,
can't
my
get
daughter
over
won't have a
it.
baby. I know.
They say they cannot get over it.
My daughter's partner was like, Anthony was like, the baby's head's coming out, and he's going. He's going back, 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 back. And the nurse just looked at me, and I was like, somebody better hold him. And he's going. And then when she came out, it was, oh. It was like, oh. It was like,
Have it on the, by the head.
yeah, have the
No,
top.
no looking.
Yeah, usually they asked him to cut the cord, and he was like, I'm not going to cut the baby. I was like, yes, he is. I was like, somebody better cut the cord, not him. But he was really scared. But they're young. So that's a breech birth. Let's see. I want to talk about something else. We're going to, also one thing that happens to women in pregnancy, some of the complications for women in pregnancy are diabetes. Especially if you have history of diabetes in your family, your chances are higher that you may develop diabetes in pregnancy. And that's called gestational diabetes. That means that you only get it when you're pregnant, which sorry, puts you at 40% chance of developing diabetes as you get older. And so it increases your chances. The problem when you get diabetes when you're pregnant, your babies could be very, very large because of the sugar. And two, when the babies come out, the babies can have a drop in sugar. They got so used to the high sugar of the mother that when they come out, their body has never had to maintain the sugar. So when the baby comes out, they plummet. A low sugar can kill a person much faster than a high sugar. So it can really harm the baby. So when the babies come out, we have to give them water with sugar right away. We test their sugar and give them water with sugar to make sure that they don't plummet. Because if they plummet, it's very dangerous. They usually end up in the intensive care unit just to be on the safe side, in case they drop too fast, and then we need to save them right then and there. So preeclampsia. It's also extremely dangerous for the mom because your blood pressure, preeclampsia elevates your blood pressure. Something's going on in your body that is, all these hormones are elevating your pressure so high that you could have a stroke. Now, if your blood pressure is so high, your baby's under that same pressure. So that can actually harm your baby. So it's very dangerous for mom and dad to have those elevated blood pressures. So we usually either put you on blood pressure medication or on total bed rest to make sure that your blood pressure doesn't get any higher just by total bed rest, just by resting. And if you look in page 144, it also tells you there's something called eclampsia, which is the pre-eclampsia is before all these bad things happen. That your blood pressure starts going up, that you start swelling, all these things. It happens more on first and second pregnancies than any other pregnancies. But I know one patient that actually has had preeclampsia 3 pregnancies in a row. The poor woman.
Eclampsia is bed rest, right?
Yeah, bed rest and sometimes high blood pressure medication, depending how high the blood pressure is.
What thing?
144.
Gestational diabetes, you can control like I did. I was following the diet, my child
Yep.
completely fine.
Good.
So if you want to do it, you can. It's just you
Yeah.
don't have to use any insulin or
Some ladies, even though they behave like you did, their sugars still go up because it's a hormone thing. So sometimes, but yes, you can control it, and that would be for you not to gain weight, to keep your weight down in your life, so this way you don't expose yourself to the diabetes. Yes.
So after the pregnancy diabetes thing, the mother will be subject probably to 40% of having diabetes when she's older. How
Yeah.
about the kid?
No, we have no numbers. They will say that. No.
That's
No
not
numbers.
fair.
Yeah, I know.
Getting you bring a child to the world and we got punished.
Yeah, we did. We got punished all the way anyway. No. Yeah. Well, yeah, it's a good thing that the kid doesn't come out sick. I mean, that means that on top of that, right? Yeah. Most of the biggest babies, we don't get a lot of big babies here, but I have seen 13 pounds and 14-pound babies.
14 pounds?
That baby was wearing like a size 1 already. The kid was like huge. Yeah, huge. And she had 4 babies before that. They were like, she started out I think with like 10 pounds, the first baby, and it just got bigger and bigger. But she had diabetes, and that was the problem. She had diabetes, and that happens a lot with diabetics, really big babies. We also, when we deliver a baby, we want to make sure we don't have any meconium in the water. Meconium is that poop that I told you about, the black poop that they when they're like first or second day born, they get rid of. Occasionally, there is babies who actually poop inside the water bag. That's extremely dangerous because that poop, that stuff that blocked, lives inside our body, but cannot live out of our body because it's poison. The moment it touched the water, it turned into poison. So it poisons your baby. So meconium is extremely dangerous. So when a woman water bag breaks, the first thing they ask is the water clear? What color is the water? Because if the water is like green or light brown or too yellow like mustard, something's wrong and we need to take the baby out now. And so usually you end up with an emergency C-section. Yes. Oh, sorry. Okay. The amniotic sac is the bag where the baby is. That's where the baby is. Yeah, if the water is tinted when it comes from there, when it gets out. Also, like sometimes when we have a C-section and we open up and try to take the baby, and then we see this stuff there, we have to be extremely careful because if it spills out of the bag, that now we end up with the mom having issues too, because it turns into poison. All right. So we're going to talk about. We did talk about cervical cancer, the Pap smear. That's what we do, just a scraping. And this basically talks a little bit about ovarian cancer. Ovarian cancer kills more women than uterine and cervical cancer put together. Yeah. It is most common in women after age 50, and those women, they have never gotten pregnant. The same thing, it has something to do with the hormones working. The same thing happens, breast cancer is higher on women who never breastfed a baby than women who have breastfed. So breastfeeding, actually using those hormones and working, making your body work like it's supposed to, actually helps them. So you will find that it's more after the age of 50. Also, the fact that, like I was mentioning earlier, a lot of women don't go get their Pap smears after 60, 70, 4, and they need to do the Pap smear or at least a pelvic exam to make sure the ovaries are okay. Cervical cancer in women is linked to human papillomavirus, also known as genital warts. As we know, we have vaccine nowadays that we can give the young women when they're pre-teenagers or earlier. And this vaccine is supposed to be given to the young women and young men, because now it's for men too, young women and men, before they start having sex, before they get exposed to this virus. It works with most of the viruses. The human papillomavirus is not just one virus, it's multiple viruses in one. So it depends on the kind of virus you happen to get. So some of the vaccine works in most of the most common viruses to try to stop cervical cancer, but not all the viruses, but most of them. And having genital warts have the same virus. The genital warts, the problem with warts is they come back whenever they want to. So it's like herpes, that's herpes. So herpes carries this on it. So when a woman has herpes and they're pregnant, and it's just before they're due to have their baby, we have to check to make sure that the virus is not alive, because if the warts are present or they look like they're coming out, we need to do a cesarean section. Yeah, because the virus can cause blindness, it can cause brain damage. This virus is really bad for a newborn, for a baby's brain. So it can cause a whole bunch of things wrong with the baby. So they have to do the cesarean section. So if the virus is dormant and there are no lesions anywhere, then we try natural birth. But normally we prefer to do a cesarean section. So this, the papillomavirus, now more than 50% of us sitting in this room have been exposed to this virus already. It's a very common virus. Now, your body is supposed to get rid of it. The problem is that some of us, the body doesn't get rid of it. The immune system is supposed to take care of it, and it just stays. So a lot of times they may test you, and you may be positive. So they'll say, we'll wait to see, we'll check you in 6 months and see if it's still there. And they'll do another smear to see if it's still there. If it's still there, they may start watching you